Our sickest patients are frequently harmed inside our healthcare systems. Medical error is the third leading cause of death in Canada. And in the US and South Africa, where I'm from, it's just as high. Complex cases like cancer, heart disease, and diabetes have multiple specialists, multiple visits, and multiple opportunities for deadly mistakes. I know. I nearly died from mistakes. I'm here to say you can catch preventable mistakes. You might save a life, yours or someone you love. I didn't know this years ago. I'm at home, it's 3 a.m. and I wake up with an excruciating headache. I have nausea and heaving over the toilet. I'm not pregnant or hungover. My husband, Marchand, drives me to the emergency room. Have you visited the ER? Hours of waiting. Rewarded with a fashionable backless blue gown. I'm too sick to care. I get needles into my veins and into my back for spinal fluid. I feel like a human pincushion. Brain scan. Yep, my brain's still there. I just want to go home to my 4-year-old son, Aiden. The ER doctor arrives, someone who's used to giving bad news all day with little empathy. I call him Dr. Blunt. He says, "Claire, you have a small brain tumor, but it's not causing you headaches." What did you say? You have a brain tumor. I recommend yearly MRIs or brain scans, but it's not causing you headaches. What? I have a brain tumor? It's not causing my headaches? Yeah, meningitis is causing you headaches. With medication, it'll resolve. You can go home. He walks out. What? I have a brain tumor? I have a ticking time bomb inside my head? And no one knows when it's going to go off? What? It's dark when we get home. I peek in on Aiden, asleep, his little chest moving up and down. More than anything, I want to watch Aiden grow up. Next morning, 3 a.m., I wake up. This time, I'm scared. I tiptoe to my computer. I need to educate myself and ask questions, but to be honest, I don't know where to start. I don't know what to do. Fortunately, Dr. Google is on call. I find a Facebook brain tumor support group, and on it people are saying, get copies of your medical records and be a tracker. Track everything your doctor says because mistakes can happen, from simple oversight to something more serious, and mistakes can add up. Aiden walks in, sleepy-eyed. It's 5 a.m. "Mummy, what you doing?" How do you tell your child you have a serious illness? "Hi, love. Mummy's sick, so my friends are saying I should be a tracker, so I'm educating myself. I'm being an asker." "Mummy, I thought you were a manager." "Oh yes, love, I'm still a manager." "Okay, I go play," he says, back to his animals. My son reminded me I'm a manager at work. So how can I think like a manager about my health? I know I need to track my medical records, educate myself, ask questions, and manage all my appointments and medications. Spells team. Interesting. Look here. Track, educate, ask, manage. My support group, my family, and my doctors are also on my team. This is like a team approach to manage my health. Little did I know, this approach would save my life, because I would catch mistakes that could happen to anyone. Let me show you. Mistake 1. Dr. Blunt said, brain scans every year. But in his report, he wrote, 1 brain scan next year, with no reference to every year. I flagged this. A small mistake or simple oversight. Mistake 2. Year later, brain scan time. Dr. Brain, my neurologist, says to me, Claire, your MRI is stable. No further MRIs are needed. This feels good. I go home and tell my Facebook brain tumor support group the good news. Until they remind me, the medical standard of care, which is a thing that most doctors do, is brain scans every year. I asked for a second opinion. Who confirms this? I caught a mistake without harm. Medical opinions can differ, but when it doesn't feel right, keep asking. Mistake 3. A year later, I wake up at home to a spinning room and my eyes can't look up. So my family doctor sends me to the neurologist on call, Dr. 24/7. He's dismissive and very overworked. Doctor, I am dizzy and my eyes can't look up. Is this a symptom that my brain tumor's growing? Claire, probably an in-ear infection, he says to me. And he sends me home with no medication, no follow-up appointment, and no brain scan. Now, this was a mistake, according to a subsequent medical board review. I'm an optimist. No one was trying to harm me. Humans make mistakes. Mistakes now, adding up. A week later, and I'm still dizzy, and I develop an intense headache. So my family doctor sends me to the ER, and I make doctor busy. And I know what I need to ask, because my husband and my support group have given me advice. Mistake 4. Doctor, I have a brain tumor. I am dizzy with an intense headache. I think I need a brain scan. Claire, I've spoken to your neurologist. We're increasing your medications. No brain scan. You're good to go home. It's common for doctors to trust the specialists. Is this a mistake? Well, next day, I'm confusing my words, and my legs are weak. My husband drives me to our family doctor. He's demanding a brain scan. So my family doctor refers me for a private pay MRI. My brain tumor had doubled in size. My worst fear. 5 days later, brain surgery. Thank goodness for my team approach. Track, educate, ask, manage. For my support groups, my family doctor, my husband demanding a brain scan, and for the medical team that finally saved my life. Without them all, I wouldn't be here today. A collection of mistakes would have died with me. Healthcare systems are complex and overburdened for both patients and doctors. Mistakes can happen. We're only human, after all. Because this is life, you need a team approach. Learn to track, educate, ask, and manage. Gather your support groups, families, and doctors at your side. Your life is too important to take lightly. Be proactive. Take responsibility and put your health in your own hands. You might save a life, yours or somebody you love.